Hello, and welcome to Another News. My name is Matt Margolis, and I'm here with my partner,
Lauren Weldon. We are Margolis Weldon. We are estate planning and elder law attorneys, and the goal of this program is to give our audience a little snippet as to some interesting people and interesting topics that we think will entertain them for a brief period.
And today we are lucky enough to be here with Katie Sullivan. So thank you, Katie. Katie's a family nurse practitioner, and she's the founder of Modern Compassionate Care, an integrative wellness clinic that specializes in medical cannabis therapy for children and adults. Katie earned her master's in nursing from the University of Illinois at Chicago. Throughout her career, she's worked in primary care, oncology, women's health, and adolescent medicine, helping people of all ages manage diverse health challenges and chronic conditions. Katie believes strongly that cannabis is a safe and effective medicine that has the potential to increase quality of life for many people who are not getting adequate symptom relief through traditional treatments. Her philosophy for nursing care is client-centered, evidence-based, and trauma-informed, with an emphasis on educating and empowering patients to chart their own path to wellness. Katie's an active member of the American Cannabis Nurses Association, the Society of Cannabis Clinicians, the American Association of Nurse Practitioners, Illinois Women in Cannabis, and the Illinois Cannabis Equity Coalition. Woo! She also sits on the Illinois State Advisory Board for Medical Cannabis. So it sounds like we're here with somebody that knows a lot about medical cannabis, which is exciting. So I will leave it to Lauren. I think Lauren's got a question for you, Katie.
I do. Katie, thank you for joining us here today. How did you get into cannabis nursing, and what exactly does your job entail?
Hey, Lauren. Hey, Matt. Thank you guys so much for having me. So I got into cannabis nursing kind of in a few different ways. I became a nurse because I was widowed young. I had a husband that was, he was a Marine. He came back sick from the war, and through, like about 4 years, he got really sick and eventually ended up passing away. And, I was about 27. So that's like the first experience I had with estate planning. And at that point, the experience that we had going through the medical system, he was overtreated for, what was going on with him, and then ended up contributing to his death. So I wanted to help other families that were going through kind of similar situations that I had been to, and be a point person, be an advisor. So I decided to go into nursing. I went to nursing school, and then I got my master's. And my background's kind of in oncology. So I started working with a lot of patients that were using medical cannabis when I worked in stem cell transplant. And I was pretty astounded by what I saw as far as the efficacy of that to help with things related to chemotherapy, nausea, vomiting, allowing somebody to get an appetite so they can eat, helping them to sleep, working better than the medicines that we were giving them in the hospital, and with, a lot less risk. So that really intrigued me, and I started just deciding to pursue more education in this field. And I found that there was a huge gap in care, that there were a lot of patients using medical cannabis, but very few clinicians who were knowledgeable about it, able to actually guide patients in the treatment of it. So I decided to kind of leave traditional nursing and go into doing this full time. So I work with kids and adults, all different conditions from, autism, epilepsy, cancer, arthritis, sleep issues. I mean, you name it. I see a ton of people and I see great results. So that's how I started doing it. And what a cannabis nurse really is just that. We are knowledgeable in our body's endocannabinoid system. We're knowledgeable about the cannabis plants, and we can guide people in using it to treat medical illnesses. And like a big part of what I do is going through their other treatments, their medications that they're taking, seeing if there's any interactions, and allowing them to learn how to use it safely. Basically, that's it. So I'm a point person for anybody that's interested in this, or who has a condition that they're not getting relief. And, most of the patients I see have been through it. They've seen a ton of different specialists, tried a ton of different treatments, and they're seeking me out because almost as a last resort. And I'm sort of, like I mentioned in my bio, I want people to use this as a first line for some things because of how safe it is. It's a better option. So that's how I got into this. And that's, basically what I do.
Good.
Well, I'm so sorry about your husband, Katie. I didn't know that. And obviously, the world throws us curveballs, and it seems like this one obviously got you into, or at least kind of helped guide you into the role that you're currently in and the path that you've been seeking. And obviously you do so much good for the clients that you work with and your patients. So nice to turn an unfortunate event into something very positive. So
Definitely.
I know you touched on, this being beneficial could be beneficial for adolescents and adults. But we're an elder law firm, so I have to ask, why are or are older adults good candidates for medical cannabis therapy?
They're excellent candidates. It's actually, but when I set out to do this, I was aiming to try to help older adults, because older adults are often, what I found, over medicated. They're often the type of people that have to see many different specialists, right? They'll have a heart condition. They'll also have, a neurological condition, things like that. So they're on a lot of different drugs. They're seeing a lot of different specialists, and often they don't have a lot of central, like a person who's kind of looking at across the board and saying, okay, is this working, the treatment as a whole? Is this good for this person? And as we age, our bodies are less able to metabolize drugs as well. So we need to always be looking at older adults' medication lists. And to me, cannabis is a thing that can replace a lot of medications that I see as having negative side effects. I see some people that use Advil every day, and they've done it for decades. That's real hard on your body. There's a way to use cannabis actually as an anti-inflammatory that doesn't have any of those negative side effects. And they also confer other benefits, anti-inflammatory activity throughout the body. There's a lot of studies with encouraging data that cannabis is a neuroprotectant that can prevent dementia and Alzheimer's, or slow the progression of the disease. So in addition to being a great sleep aid, a great pain reliever, a great anxiety medication that's very safe for an older adult that could sometimes replace more than one medication on their med list. And in addition to all of that, it has these other benefits that I feel are like, we're not even talking about them enough, how this could be a preventative wellness, agent that we should be considering using in a lot more patients than we are. It's very safe. So, for arthritis, for Parkinson's, for cancer, all things that, older adults, those are the people I'm seeing, and I'm seeing great results with them. So, but it's daunting. And I think that for the older adults, there's a clear break in the generation of, I think, the older adults who have not used cannabis and the ones that were kind of part of the hippie generation who have. So I see kind of two different type of clients when it comes to older adults. And I love working with both, either, letting them know what cannabis is now versus how they knew it in the 60s, or, kind of talking to them about, the real safety of this drug. It's not reefer madness. It's not, there's a lot of fear surrounding cannabis because of the narrative around it. But to me, that's why I like doing what I do, because most older adults aren't. If they've never tried cannabis, they're not going to go into a dispensary and just try cannabis. It's better that they have a clinician guiding them through. And if you're on a lot of medications, you shouldn't just be messing around with that. You should get some professional guidance. People get better results. So for me, older adults are the clients I love to work with, them and their families, and try to see if we can get them on a safer medication regimen and extend their life.
So that brings us to our third question, which I think you kind of touched on. But so given the availability of cannabis nowadays, and you kind of touched on this idea that an older adult, given the amount of medications they're on, shouldn't just be walking into a dispensary and asking for something because it could interfere with existing medications or what have you. But what are the benefits, in your opinion, of being a medical cannabis card holder in Illinois, and how do you start that process?
So it's the benefits. Number one would be you don't have to pay the state tax. So if this is something that somebody is using on a regular basis to treat anything, they should be considering being part of the medical cannabis program, because we pay 34% more in state taxes for adult use cannabis customers. So that tax is waived for medical patients. So affordability is a big thing. You can grow your own. I do have a lot of older patients that are gardeners that are really finding a lot of therapeutic benefit in the growing aspect, as well as that being another affordable option. And then the other thing that I find really helpful for older patients is medical patients get some benefits, like a lot of dispensaries have curbside pickup where you could just drive there and they bring it out to you in your car. Or as a medical patient, you could also, if you have if you don't drive anymore, you can have your, child or a partner or a friend be your caregiver. You can have up to 3 caregivers, and that person can go to the dispensary and purchase cannabis on your behalf and bring it to you. So that's another big thing that's helpful for older people. And I do see in the future that we're pushing for Illinois to have home delivery as well. And that will likely be available, at least at first, to only medical patients. So there's little things like that. It's very easy to join the state program. For seniors, they have a reduced fee of $25 a year to be part of the program. And you just need to, any nurse practitioner or doctor could certify you for the state system. Some hospitals don't allow their providers to do that because they accept federal funding. Some providers are not comfortable doing it because we're really behind in medical education when it comes to cannabis. So they just don't have the training. So some people's doctors are willing to sign them and get that certification, and it's just something they do on the computer. Other people come and they find a cannabis clinician like me, and I help them get certified. I can certify them for the system as well. And then, I suggest they follow up again with a cannabis clinician to get guidance on how to use cannabis. And that's really how you do it. But it's not a super involved process. It is a little bit of bureaucratic to do, but it's easy and it's worth it.
Good.
If you're using it.
That's awesome.
Well, thank you so much for taking some time today and sharing your knowledge with us.
Oh, I'm so happy to. Really, really nice talking to you guys. And, you just direct anyone, if you have any clients or anyone that has questions about this that might be able to use this treatment for anybody, feel free to give me a call. It's like there's a lot of people that just have questions and they're not necessarily ready to make an appointment. Just call our office. My business partner is a licensed clinical professional counselor. So she provides mental health therapy, and she's also kind of cannabis informed. So we offer that service as well. And we do telehealth appointments, again, for people if it's easier to stay at home. So, but if you just want a little information, give us a call. We're happy to talk to anybody.
Awesome. Well, we really appreciate you being here with us today. For everybody watching, Katie's information will be in a link below the video. And thanks again. And then to everybody watching, appreciate you tuning in, and we'll see you next time for some other news.